What surprises most students after the first tutoring session is that we hardly touch any practice questions. They come in ready to grind, and instead I'm taking a history, not like a medical history, although sometimes that is relevant. I'm talking about a study history. I want to know how they've been studying, what resources they've got, their timeline, what their school's actually requiring of them, what worked and what hasn't worked, everything. It's the same kind of deep history that you take on a patient to figure out their diagnosis, just pointed toward how you study for boards instead. If I'm thinking the student's approach to questions might be the primary source of their stagnant scores, then we'll do some questions. Questions or no questions, though, I use that information to create a study plan for that student to address their specific weak areas. And by the end, every single one of them is more confident than when they walked in. Not because we drilled 100 questions that first session, but because for the first time, they have a real plan. A plan built specifically for their weak areas. There's no more guessing or jumping around between random resources at midnight. I'm telling them exactly what to do on what days, at what times, and all they have to do is go do the work. So if you're hoping session 1 is me throwing UWorld blocks at you, that's usually not it. You wouldn't treat a patient without first knowing their diagnosis, right? That's exactly my mentality for tutoring. If that sounds like what you've been missing, the first 45-minute call is free. Links down below and in my bio.